These women were strong, knowledgeable, and determined to spread the word that what had happened to their children could happen to anyone's. Because when it comes to diagnosing kids with psychiatric disorders, no one really knows what they're doing, as a group of high school students found out when they interviewed psychiatrists at a recent psychiatric convention.
With all the diagnoses out there, how do you know which one to choose?
For a patient?
Yeah.
The diagnosis?
This is a good question.
Well, it can be pretty difficult to pick a diagnosis.
Psychiatry is not like other fields of medicine, and the diagnoses are sometimes kind of muddy.
Yeah, just often pick and mix, so it's not that difficult usually.
I pick the psychosis group of diagnosis.
We don't always make the perfect diagnosis, but we try to make one and revise it.
It's really hard. We're oftentimes wrong half the time.
Sometimes we don't need a diagnosis.
Oftentimes it's not for us as important what the exact diagnosis is.
Diagnosis is based on what is it for. If it's for reimbursement or if it's to get you off the hook.
You develop a list of possibilities as to what the diagnosis might be.
Well, asking all the questions in your mind. You can't ask all the questions of everybody ask. You can't ask everybody all the questions, so you have to do the questions in your mind and ask the right questions. And then you pin down. I don't know if that's the right answer.
Whatever your answer is, totally fine.
Matthew's doctor never informed me about the unscientific nature of her diagnosis or the serious possible consequences of taking the psychiatric drugs to treat it. So I went to see the well-known physician and author, Dr. Doris Rapp, to find out what I should have been told. My son was put on the drug Lexapro, and we were told that the side effects were very benign, headache, dry mouth, nausea. What serious side effects should I have been warned of?
Well, drugs such as that can cause depression, it can cause dizziness, and there are many isolated reports of almost any area of the body being affected by those. These are the ones that cause the depression, the suicidal thoughts, the heart disease, the metabolic defects. And I think that obviously lung function and cardiac function need to be monitored on children if they are finding enlarged hearts and the children are having heart attacks and strokes and increased blood pressure and irregular heartbeats. And it was found that many times when you stop these drugs, the symptoms don't disappear. You think that shaking is going to go away. It may not go away. And there's nothing more devastating to a young child than to twitch and have these jerks in their body that they can't control. You should have been told to watch for any change in how your son feels or acts or behaves. Any change in his appetite. Is he dizzy? Does he have problems with his coordination?
Right.
Did they tell you to contact them if there was any change?
No.
They didn't give you a sheet with side effects?
No.
That you should have received a sheet that said these are the things you might look for. And if you notice any of these, but I think most people would be scared silly because it might be a whole page of side effects and you might not even know the terms, but you get out a dictionary.
Or it's in print that's so small,
that's right.
You can't even
You
read.
get a magnifying glass. And I'd say that you shouldn't have to be the doctor, but in today's day and age, with so much going on that shouldn't be happening, I'd say parents, go check on what your children are taking. Don't assume that it's normal to have a reaction if you're seeing one. Call your doctor up and complain. Get a second opinion. But you've got to cover yourself in every way that you can possibly cover yourself. I think you can't drug healthy bodies and make them unhealthy in so many ways and expect those individuals to grow up to be a functional, creative persons in the society. They simply won't be able to reach their full potential because the drugs change them. I think that what is going on is a sin. God must be standing up there saying, "What are you doing down there? What are you doing?"
I agree. Thank you so much.
You're going to make me cry.
Thank you very much.
We have some tea inside here and coffee.
These are dangerous drugs that don't cure anything. And the diagnosis of ADHD is it's just epidemic right now. You know, it's so easy to do to label a child that way, and then that label follows your child all the way through life.
Well, Shana was diagnosed as early as first grade. So the school psychologist sent us a letter and stated that Shana had all the characteristics of ADHD and needed to go to a doctor. So I took the letter from the school psychologist to the psychiatrist with me. 45 minutes later, walked out with a definite diagnosis of ADHD and a prescription in hand. They judged her whole entire life on that subjective checklist and put her on drugs right away. Progressively, she would revert back to where she'd fidget in her seat, and the school would call and say, "Shana's not paying attention again, she's out of her seat," you know.
Up the dose.
Up the dose, up the dose. February 26, 2001, I received a phone call from the school nurse at exactly 10 o'clock and said Shana had taken a fall in library. And immediately I went to school to get her, took her to the doctor. I was only a few feet away from her, signed her name on a clipboard. I turned back, and she's having a grand mal seizure. I picked her up in my arms, and I screamed for the doctor, and the doctor said, "Vicki, lay her on the floor." I immediately laid her on the floor, but I kept her head right here, and I kept massaging her head and said, "Mommy's right here, Sissy, I'm not going to leave you." And I looked into her deep brown eyes, and the last vision I seen was my daughter dying, and there was nothing that I could do to help her. And I didn't know at the time. Does she know? I didn't know. Did she know that I couldn't help her? What was going through her mind while I'm watching her die? And I have no idea. The answers will never be there. But I keep looking back and thinking, I did what was best, what I thought was best at the time. Even though it turned out to be deadly and I buried my child, I'm not the blame. A week before Shana died, I took her with agitation, low urinary output, and weight gain, which were 3 red signs. And I took him to the psychiatrist and I said, "This is what's happening." And he told me that I was an overprotective, paranoid mother, and what I was seeing were not side effects. And I look back now, and that whole week, she was dying, and we didn't know. And they told us that even if they would have done something different, we still couldn't have saved her. She had too much in her system, and she was dying little by little. So when I say, even if you would have noticed anything, they wouldn't have paid attention. They chose just to ignore me. The psychiatrists, the pharmaceutical industry, they're the people that I need to blame and hold accountable for what happened. And, you know, I look at it now and I just wish I could turn back the hands of time and never put her on the medication, never believed in the professionals, did everything in my life differently, but I can't do that. All I can do is go forth now and talk to people, express the concern, reach my hand out and touch every life and hope it makes a difference.
I had no idea that psychiatric drugs could create so many horrible side effects in so many people. An estimated 42,000 deaths every year whether by homicide, suicide, or overdose, are linked to psychiatric drugs. There was one thing I just didn't understand, though. How could a drug, especially one that was supposed to help, cause a person to take the extreme step of deciding to kill himself or others? Matthew would never have taken his own life. It must have been the drug. But how? I asked this of Pamela Seefeld, a pharmacist and an expert on the adverse effects of psychiatric drugs on the human body.
It's very nice to meet you. Yes. Thank you for taking the time to speak with me. My son was only on the one, but he started off at one dose and did not do well. And it was after that his demeanor really started to change. He became very anxious, very withdrawn, more withdrawn than he had been, because at least before that he was still talking to us. And within 9 weeks of starting the medication, Matthew was gone.
The symptoms that you're describing, the description of these symptoms, it's very classic of drug-induced psychosis, because he couldn't metabolize it. You have to understand, it wasn't his depression that got him. It was the medicine at a toxic level in his brain that made him psychotic. And that's what it comes down to. I'm telling you, the drug metabolism issues are killing a lot of people. If they're only offering you medicines, and the medicines have this possibility of causing psychosis, that's what's really happening. The person's drug level gets toxic in the brain. These medicines like Lexapro, Paxil, Zoloft, they have to work in the brain. That's what they do. They pass through the brain, and they work on those receptors in the brain. If you think about it, if you have a normal dose of a drug and people don't do really well with it, if the increase in the concentration is 5 times, think about what that does to the person. 5 times the normal amount of drug in the brain. People always become psychotic on it, and they call it drug-induced psychosis.
Well, I feel very strongly that's what happened to my son.
I'm sure of it. When your son was given those medicines, you know, he can't metabolize those. He had a toxic level in the bloodstream and in his brain, and as a result of that, he took his life. And what has happened is that they're not looking at the real facts. The drugs are very dangerous.
And they know.
Yeah. Oh, yes.
They know that this is happening.
And nothing's being done. Let me tell you that. No. Nothing's being done. And so, if I can bring you a science reason, it's not obscure like drugs are bad, medicines are bad. It's not that. I'm telling you, there's science behind what we're discussing here, and I'm just really glad I could be the pharmacist to tell you what's really happening. I want to share this with a lot of people.
Well, and I appreciate it so much.
Thank you.
Thank you.
It doesn't take much looking to find some pretty horrible examples of children who became extremely violent after being put on psychiatric drugs. Kip Kinkle, for example, shot his parents, then went to his high school and killed 2 and wounded 23 more while withdrawing from Prozac. Christopher Pittman was taking Zoloft when he shot both his grandparents and burned down their house. And Eric Harris, who killed 13 people at Columbine, then committed suicide, was on Luvox. 9 of the last 13 school shooters were either on or withdrawing from psychiatric drugs. And the medical records of the others are sealed, so we may never find out the truth. But instead of warning us, psychiatrists and drug companies are playing down the most serious side effects and ignoring the rest.